And the company's been great and everybody's been very responsive. And the first thing I do when I get these things is try and break it and see how far I can kind of push it. And so, but at this point, I've got it pretty well ironed out in terms of how to my workflow, because I'm kind of a one-man band here. And because the hospital and everything is very gun shy about cloud stuff or sharing medical data. And so a good chunk of my talk is sort of how to integrate this into your workflow as just a surgeon in academic practice. So the simulation lab, the asterisk is just because, you still got to practice somewhere. But in terms of planning your surgery, I mean, this is an in-office thing. I do it at my chair before I go to the OR. And so it's very straightforward. And so I'll get started. And so but I appreciate you guys having me back. And it's always great to talk to you guys. And the world of people who know about this stuff is pretty small. And so it's good to be here. So the moves that I have before are this is in 3D slicer using volumetric rendering. And so you can get a pretty detailed picture, but it can be hard to tell tissues of similar density apart. And so that's where segmentation comes in, and it's painstaking to make yourself. The AI helps a little bit, and also you can export and print things, and I do that, but there's a lot more work involved. And so the way that I normally approach a surgery is I'll use the segmentations as landmarks. I'll because I don't want to model all these tiny little vessels, and so I can basically line up my shot. So this is a pancreatic mass, but before I know I'm going in, I can say I got this window, there's the portal vein, and I can get my stapler across and it works out. So in terms of my workflow, I use a virtual desktop app. Each one has a corresponding PC. The animation at the top there is because my son said I didn't have enough animation in there, so he made me one. This is so everyone's wireless tethered over Wi-Fi 6, and then all the PCs are directly connected to the router. And so you can see there's two laptops, then they're just running to a router in my office. And it's a dedicated router just for the headsets and for the laptops. And then within a few seconds, I can get my monitors showing a feed directly onto the VR goggles. This is a Quest 3. And so the latency is pretty low, and because they connect over either five gigahertz or 6. And so booting the application, everything is pretty quick. And then from there, it's just a part of my office. And so if I want to pull up a scan, these are all stored locally on SSD drives, and so I can just pull it up and put it on my desk and just start working. And so I can be nothing to VR in less than 5 minutes, and the longest part is downloading the DICOM files. So if once that gets integrated, that'll be very helpful. And so the thorax is nice because you have lungs there for contrast, and bony structures are great to look at in VR just because you can see them really well. And so when you have the PC, the hardware is a little bit more powerful, so you can do things like masking, and I can basically whittle on the model, and I can take off the specific parts that I don't want to see, and then I can do, in this case, I'm measuring sort of the width of the bone tumor itself, and then the planned margin of resection on the bone. And then, once you adjust the contrast a little bit, you can just cut off that piece and have a pretty good plan. And I do a lot of pectus surgery. And so, and it's just sort of planning hardware placement, and it's helpful to know the relationships of, things like heart and lungs and stuff. And so what I can do is I can sort of use the total segmentator and use the AI model to bring those organs in. And then that helps me it's just more data, more information to look at while I'm doing these planning sessions. And so, I really appreciate the ability to sort of, manipulate the translucency of the entire volume rendering, but also of the individual models. And so as I want to replace things, I can remove the volume rendering, put it back in. And then when I'm done, I can sort of have a better picture of where I am in space. And so you can see all the blood vessels and everything pretty well. And so, this is a non-contrast scan, but you can see there's a mediastinal tumor there, and it's next to the aorta, and it's next to the pulmonary artery, and so that can be really helpful. But and then the abdomen's where things get dicey because everything's very similar density, and so you have to be really specific with your presets. So yeah, any assistance to that, I'm looking forward to trying that. And so in this case, there's a cystic mass in the liver, and this is trying to gauge sort of the proximity to the hepatic vessels and to the portal vessels. Once you this is a teenager, so they're a little bit bigger, and CT scan is a little bit more straightforward to use. But even still, when you have a cystic mass, it's the same density as every water containing structure around it. And so, and again, 2D representation is never as good as the real thing. And the other thing I was looking at is, can you use this? And he's a skinny guy, so I probably don't need it, but can I sort of mark out, and like Dr. Glow was saying, that it's really helpful to anticipate your site and to plan ahead. And so I'm looking forward to the templates, and then future AR applications. I'd be excited about that as well. But and then once we have our holographic monitors and all those things, it'll be a lot more. It's a great software. It's very straightforward, and I enjoy using it. And so I'll give you back your screen. But yeah, again, thanks for having me, and it's always a pleasure.